And you mentioned measuring the blood pressure. You're not going to have a systolic and a diastolic blood pressure. So how do these patients know that their blood pressure is okay?
We use a special way of measuring blood pressure in these patients, and that is called a Doppler blood pressure. And what it means is basically you put a Doppler, which is an ultrasound probe, on the radial or the brachial artery, and you first assess a sound. It's not a pulsatile sound like we normally see. You don't hear that. In fact, you just hear continuous flow.
Yeah.
And same thing when you actually try to get an arterial line in these patients, you will be surprised. It's almost like, I mean, it's not like spurts of blood, it's
Yeah.
a continuous fountain
Yeah.
because it's continuous flow. So once you establish where that flow is, then you put a blood pressure cuff above that and you inflate it until you don't hear any sounds. And then you slowly deflate that cuff. As you deflate it, the moment you start to hear that sound again, that approximates to your mean arterial blood pressure. And that is what we use, and we target an arterial blood pressure to be between 70 to 95. We want that blood pressure to be not too low, but not too high as well. And that's where the left ventricular assist device is the happiest.
And do you teach patients to do it at home, or that it has to be done in a clinic or in the hospital?
It depends. We prefer it's a bit more cumbersome to do it by yourself. A number, you can't do it easily. You
Hmm.
need someone to help you. Sometimes you don't get the right reading. So we prefer that you can. We do teach patients. We do give them the ability to measure their blood pressures because if they're feeling bad or the LVAD is alarming, we want to know what the blood pressures have been. And then if there is any confusion, we just bring them into clinic and have them go through our assessment.
And
We really get to know these patients very well for the rest of their lives.